Even though the Vietnamese American Service Center has been open for 3 years, it's still hard to put it into a box.
When someone asks me to describe it, what is it? Is it a health clinic? Is it a community center? Is it a government center? Is it a cultural center? I say it's all of the above.
1, 2, 3, 4.
Step inside the vasc, and you're likely to see people stretching in an exercise class. While just a few feet away, others are checking in for a doctor's appointment. The center integrates medical and dental services, nutrition programs, and community wellness. It's aimed at the Vietnamese American community, which makes up more than 100,000 in San Jose, about a tenth of the city's population.
When we become that trusted place for our community, they'll come to us for that, but then they'll learn about all these great services.
The idea for the VASC came about a decade earlier, after the county did a health assessment of the Vietnamese community. It found many did not access preventative care, even when they had health insurance.
Of those who did have health insurance, up to half of them, their health care plan was to go to the emergency department when things got really bad.
Before becoming a county supervisor, Betty Jung was a program manager, working on getting the VASC from dream to reality.
We learned that there was a language barrier, a cultural barrier. You want to be treated by doctors and care providers who looked like you, who could speak your language.
The Vietnamese community had a voice in the process.
If we walk around the VAS, we see Vietnamese culture and heritage reflected in the architecture, in the design of the building.
The panels on the exterior of the building is all meant to be an architectural representation of bamboo. In Vietnamese, we say "Sao lửa chia làng." It's a saying that said, behind these bamboo forests is a community that protects each other.
Visitors to the VAS can now talk to someone in Vietnamese when they check in. Nearly 700 people show up every day for lunch in the multipurpose room. Medical services are on the second floor with easy access to mental health services.
Behavioral health still carries a great stigma, so it was very important that the footprint didn't have a behavioral health sign, patients checking over here.
A study found Vietnamese Americans were twice as likely than whites to have mental health problems, yet half as likely to get help.
We know that Vietnamese people have high rates of depression and anxiety and post-traumatic stress disorders.
Dr. Tiffany Ho heads Santa Clara County's Behavioral Health Department.
The way that sometimes people greet one another is they want to know, kind of like how much trauma do you go through? How did you get here?
Dr. Ho chokes up talking about her own experience fleeing Vietnam as a child aboard a refugee boat after the fall of Saigon. Her father was detained in a Vietnamese re-education camp. Her mother stayed behind.
She had packed a little bit of food for me and some water, and she said that, our family depended on my brother and me, to, just try to be good, go to school and eventually, help the family.
The VAS gives older generations a chance to talk to others with similar experiences. Tam Nguyen found a home at the VASC. She was in Saigon when it fell to North Vietnamese forces. Her husband was taken to a re-education camp for 9 years.
I cannot go anywhere, just stay home and worry. I'm crying every day, every night.
When her husband died after they came to the U.S., depression set in.
I stay home 6 months. I cannot work, I cannot do anything. I just stay home, just lie down on the bed. Everything out, everything.
Nguyen gets therapy simply by participating in the activities at the VASC. She sings at events like the Tet Festival.
I know I still have depression. That's why I want to go out, see people, they happy, they smile, and I'm smiling. I forget something.
When we ask people, what does health look like to you? It's doctors that look like me, nurses that speak my language. It also meant Friday night karaoke, Saturday morning dancercise.
What I hope is we continue to build up our community and keep contributing to the fabric of our community here in the county.
Suzanne Fawn, ABC 7 News.